There is a flap tear of the medial meniscus, and we are planning to repair it with a all inside technique. Here we are using the striker air device in a side to side fashion to first put an anchor onto the flap part. This will close the radial part of the complex tear. Air device is good because it has got good strength, good pull out strength, and we can use it in number of permutations and combinations. After that, we will be inserting the second anchor, which is tightened, and this closes the vertical part of the tear. So this way the meniscus is repaired on the with the second, and then we will put the third and the final stitch in a cross manner so that whole of the flap component is repaired. So one on the top and then one on the bottom, and this way we are closing the stitch onto its place, and this closes the flap complex tear with the vertical and horizontal components safely, and then we will do some microfracture for the best result.